What are the challenges that the center faces in achieving its mission and vision, and how do you address them?
So I think there are three different challenges we have, and it's true of most organisations like ours. The first and foremost, the obvious challenge is money. It costs money to provide the services that we provide. We have to buy food, we have to pay the electricity bill, we have to pay staff, and so on. And all of that, even though we get lots of donations of goods, even though we have lots of people volunteering, there is still a need for cash. Now, for the scale of what we do, we're not an expensive organisation, but we still need cash. Secondly, there is always a challenge with organisations like this having good managers. So it's great to have volunteers, it's great to have interns, it's great to have people who want to help, but they need to be managed. And having, as we are blessed to have, 8 key managers who run the different sections of what we do, that's critical. They are really the key to unlocking the abilities of the people who work here. And thirdly, and this is something which is particular to our situation here, is the challenge of working with government. Because sadly, government, particularly eThekwini, the local municipality, do not see the people we serve as human beings, do not see them as citizens with rights, do not see them as people to be protected and to be helped. Instead, they see them as a problem to be cleared away, a litter to be taken off the streets. And we are constantly battling with the municipality to treat people with justice and with respect, and call them out when they don't do so.
And how do you see the centre evolving in changing the needs of the community?
The centre is constantly evolving because the needs of people are constantly evolving. I'll give you a very good example. We've been running a clinic here since we began 10 years ago, but just in the last few years we've discovered there's a great need not just to test people for TB, not just to get them on TB medication, but to actually accompany them for 6 months while they're taking their medication to make sure they keep taking it, to make sure that they become healthy again. So because of that, we now run what's called a daily observed treatment program to help people get through their 6 months of TB meds. And it worked. We've had dozens of people succeed. That's not something we realised when we started up the clinic, but it's in a response to seeing the needs of people here. Another way in which I think we have clearly evolved is we spend a lot more time now helping people who are homeless to replace their IDs. We discovered about 50% of homeless people do not have an ID, even though they're South African citizens. And as a result of that, that means there are a whole load of services that they're entitled to, grants and access to training and so on, which they can't get because they don't have an ID. So hard work on our part, because this means we're working with the Department of Home Affairs, but when we can secure an ID for somebody, that really not only changes the services that they can access, but also changes their self-perception, because suddenly they become somebody who counts again, somebody who matters.
Can you tell me about the partnership that the centre has established, and how do you work with the other organisations to achieve your goals?
It's a great question about partnership. We are an organisation which has dozens of partners, and we love the fact that we work in partnership. Again, one of the risks of NGOs is to think that they have to do everything and that they are the best at everything. We're not the best at everything. There are some things we are very good at. There are some things that other organisations are good at, and so we help, we identify them and we work with them. We talk about how we can work together. So for example, we did a massive operation this last weekend called Street Store, and during that we distributed clothes to over 1,000 people. We fed them, we provided manicures and pedicures, haircuts, counselling and so on. That was only possible because of Grace Family Church, which is the main partner, and then a whole lot of other churches and DUT and various other organisations that were partners for delivering that project. We couldn't have done it without our partners. We're also very keen on creating partnership within the homeless sector between different cities. So over the last few years we've helped set up the National Homeless Network, of which I'm currently chair, and that enables different homeless organisations in Cape Town and Joburg and Tshwane and Durban to speak to each other, to learn from each other and to share information. Another great example of partnership.
What lesson have you learned in running the centre?
I guess the main lesson I've learned is never assume and never think you know what you're going to do when you walk into the office. I love the fact actually that my job is wonderfully unpredictable. There's a great sense of of seeing what the day throws up and responding to it, while still staying true to our values and staying true to our principles. The other thing is, don't lose energy. This is not a problem that can be solved in an instant. We've been working at this for 10 years. We've achieved some things, there are lots of things we still want to achieve, and you have to have the energy and the commitment to keep going. And I think the other thing I've learned is to see the funny side. If we get sucked down into somewhere, we deal with some awful situations, some really sad, miserable situations, but also there's some fun stuff. And it's good to see the funny side, because that keeps us going.
Okay, moving forward to job training program, does this program accommodate the needs of disadvantaged people?
The Dental Study Centre only works with disadvantaged people. So we work with homeless people, with refugees, with drug users, with the unemployed, people who are often the most marginalised in our community.
Okay, what is your long-term goal for the program?
The long-term goal for the program is to make sure that this organisation is sustainable. So we can solve problems, but there will be another set of problems. We're not going to remove the problems completely. So the organisation needs to be sustainable, so that in 5 years' time it's still here. It may be responding to a slightly different set of problems, but it needs to be here in order to do that. That means we have to have the courage to keep doing the things which are worth doing, but also the humility to stop doing things which are no longer necessary or no longer appropriate.
What kind of success have you seen with participants in finding a job after the training?
So one of our programs is helping people to become financially self-sufficient. So we can get people into training programs and work with them to help them find employment. But we've also created a whole scheme of our own in which homeless people are turned into second-hand booksellers. So they're not then applying for a job. What instead they're doing is creating their own business. What we do is we source the books that they sell, and we find the locations where they're entitled to sell their books, and encourage them and nurture them and mentor them, and they are effectively creating their own jobs.
What strategies are employed to make sure that the diverse community gets a full care of medical care, since you have a clinic?
So our clinic is there to provide what's called primary health care. So that means we see people who turn up who have all the things you would go to see your local doctor for: coughs and colds, infections. We can treat with antibiotics, we can dress wounds, we can also test people for HIV and for TB and make sure they get on the right medication. Beyond that then means referring people to specialists or to hospitals, and we are obviously restricted just to what's available for free, which is government facilities. And some of them work well, some of them work less well. For example, in the case of TB, we can treat what's called first-line TB, but then there are people who need second or third or fourth line interventions, and we are delighted to get very good support from King Dinizulu Hospital in supporting people who have, for example, that they have cancer. Obviously, we're not in a position to test that or treat that, and when we work with the hospitals, very often they can test but they can't treat, or sometimes they can't even test, and we're stuck then. There's just a limit to what we can do.
How do you deal with the issue of limited medication, and how do you make people understand that you have a limited medication, you can't give all of them?
So we try to provide the medication that people need. We repackage medication so that we're giving people only as much as they need, not more than they need, because people have a habit of taking some and then throwing the rest away. And we source our medicines. We get some of them from the government, from City Health. About 40% of our medicines come from them, and all of our ARV treatments and TB medication. And the rest of the medicines we have to buy. And so we spend money on those, which means we have to make sure we raise money so that we can buy those medications. Sometimes medicines are not available. So at the moment, for example, some of the TB medication that we need is not available, but it's just not available to anyone in South Africa at the moment. And that's really frustrating, especially when we end up having to buy something more expensive or something which is less suitable for the patient because the basic medication isn't available.
Okay, about the educational initiative, who is allowed to participate?
Anyone can participate in our programs if they are committed and if they have a need. So we screen people before a program to make sure that it's appropriate for them, so that we don't set people up into programs where they might not succeed because they're not ready or because they don't have the background education required. But we have no exclusions. Very importantly, we don't exclude people because they haven't got an ID, or we don't exclude people because they're not South African, or we don't exclude people because they're not the right colour. So we help those who are in need. Unfortunately, some organisations, some corporates will only fund certain kind of programs for certain kind of people, and therefore we have to work with them and either persuade them to broaden the criteria, or we have to source other funds to make sure that we can serve everyone in need, not just the people who tick the right boxes.
Okay, what kind of teaching do you use and how does that help you?
I don't understand the question.
What kind of teaching method do you use and how does that help you?
Well, the teaching methods we use obviously vary depending on what we're doing, but the approach is always what's called participatory teaching. So this kind of teaching which somebody stands at the front and writes things on a whiteboard and people write them down, looks like teaching, but actually it isn't. People don't learn that way. People learn by participating. They learn by doing things. They learn in small steps. You give them a bit of information, you give them a way to put that information into practice, and only when they've done that do you then move on to the next step. It takes longer and it takes more commitment, but it's much more effective.
Okay, how do you deal with the ones who do not have, who have limited resources?
Well, none of the programs we offer require people to pay anything, so whether they have resources or not is irrelevant. There is a problem though that we're obviously dealing with a lot of people who live on the streets. We're not a shelter, so we can't provide accommodation here. And if somebody is doing, for example, a 5-day course, but every morning they're waking up on the streets and they may not have slept well through the night, then obviously it's hard for them to commit to the course. And in a situation like that, we might sometimes see it as possible to get them short-term accommodation so they can focus on the program that they're doing.
Okay, what do you expect from their learning outcome?
From
their learning outcome.
What we expect from the learning outcome depends on what we're teaching them. Really. We don't just teach a generic thing. I'm not sure